work a lot with survivorship, and can you talk a little bit about survivorship in this setting where we have an effective oral targeted therapy that can work for many, many years? Is this still something we need to consider?
Absolutely. Absolutely. I think I started my lung cancer career a long time ago, and the notion of having people with stage 4 lung cancer surviving is to be celebrated and will always continue to be celebrated. But I think we have to acknowledge what that survivorship issues are for patients, and do some research to find out what that means for them. And we did telling to Shirish earlier on, we did a very small study a couple of years ago with a group called CAM, Cancer and Living Meaningfully, which is run by, we're helped with Gary Roden in Princess Margaret in Toronto, and it was really amazing what the findings of that were, and what we were surprised by. And it was just after COVID, but we didn't know things about, like, when people are living longer, they're feeling senses of loneliness, guilt, what the impacts are on them and on their families and on their communities. And I think there's a whole body of research that the lung cancer community and the nursing and lung cancer community can do together on what survivorship really means and affects. And I think that's a great study for us to think about doing across all continents.
And as you mentioned, Shirish, it's sort of a younger population, and so maybe if you think about family dynamics, employment,
relationships, impacts on relationships, and
one of the things I want to bring up in the context of what we're discussing is I've had the privilege of taking care of a patient who is 24 years old and has stage 4 ALK-positive lung cancer, and while on treatment with alectinib, delivered 2 healthy babies. Well, we don't have enough follow-up on these babies to be absolutely certain that they're going to be fine when they are young adults or after that. I think the reason I bring that up is that there are issues such as fertility that we may not consider in our, lung cancer patients when you take at, the entire lung cancer population, because generally they are older. So there are issues in this population that are somewhat unique, and I think we need to be cognizant of that. The other thing, going back to sort of the scan issue, one of the things I tell my patients and warn them is, the only organ that is continuously exposed to the environment, not even our mouth, is we breathe in constantly. So there is a likelihood of seeing a spot on your lung on any scan. And just because we see a spot on your lung on the CT scan doesn't mean it is related to your lung cancer. Or for that matter, any symptom you develop doesn't mean it is always connected to your lung cancer or the treatment you're on. But yeah, that is a big really issue when we do all these scans.